My dad was a surgeon, and we have surgeons on both sides of my family. And so seeing him in the office, it's very hands-on. And so that's what really inspired me to become a surgeon, to treat the babies to people when they're 100. I'm Dr. Justin Sybesma. I practice here in St. Joseph, Michigan. I am an orthopedic trauma surgeon. I do all orthopedics, but I subspecialize in both trauma and reconstructive surgery. I grew up in Wisconsin. I'm a Midwest boy. My schooling took about 14 years. I went to Calvin College in Grand Rapids, Michigan. That's how I got familiar with the western side of Michigan. And then I went to Loma Linda University for med school. Came back to Michigan for my residency in Flint, and then did a year of trauma fellowship in Dayton, Ohio. It's a long road, but it's worth it in the end. There's a lot of complex trauma that most orthopedists are uncomfortable with, particularly pelvis and acetabulum fractures. It's very deep in the body, and there's a lot of nerves and vessels. It's a very dangerous territory. It requires most people a year of fellowship to become adept at that or good at that. And that's kind of what really classifies an orthopedic trauma surgeon. I specialized in trauma and reconstruction, where we fix complex fractures of the joints and the pelvis and the acetabulum or the hip socket. I take care of the more complex trauma and a lot of deformity correction, where people lose a certain amount of their bone and we can restore that, and or they have limb length discrepancies or a lot of complications from trauma. And all of a sudden, one day, somebody's life has changed forever, and it's hard for them to deal with. And those are the types of things that I specialize in, fixing those or making them more functional. Everything is changing in medicine, technology-wise, and so they help us stay educated. We continually learn. I'm not done learning even after 14 years of training. Every day I have to read and study and review different things to stay on top of all the technological advances and the techniques. We go to courses, different courses, to brush up on all the newest techniques and technology. I do a lot of surgeries here in St. Joseph, Michigan, that haven't been seen by a lot of the people here before. As an orthopedic trauma surgeon, I often have to work on the fly, and I do a lot of polytrauma, or I've done a lot of polytrauma, where you work all over the body and you have to find some way to fix stuff. So we found I have a lot of tricks in my bag, or a lot of tricks up my sleeve to fix things. And these are things that I've learned from attending meetings and seeing a lot of other traumatologists and how they fix things. And I've seen a lot of the things. I'm more up to speed with my subspecialty, trauma and reconstruction, and so a lot of those things show up in the OR, and things that seem normal to me are quite novel. I continue just to innovate and kind of think outside of the box a bit to make things heal and get things to stay in the right spot, to bring someone through something that nobody thinks they can come through and walk again, and fix all their broken bones and rehabilitate them and get them back into society as a functioning member. It's very rewarding, and because you see your results almost immediately.